Muscular dystrophies, how muscle breaks down? Muscular dystrophies are a group of inherited conditions where muscles gradually weaken over time. In this video, we'll break down why muscles fail the role of dystrophin and how this leads to Duchenne and Becker muscular dystrophy. Let's start from the basics. What are muscular dystrophies? Muscular dystrophies are inherited muscle disorders. They cause progressive muscle weakness, and most importantly, they occur because of defects in structural muscle proteins. When these proteins fail, muscle fibers become fragile and easily damaged. Dystrophin is a muscle stabilizing protein. It acts like a shock absorber, protecting muscle cells during contraction. Without dystrophin, every muscle contraction causes injury. Dystrophin is encoded by the DMD gene, located on the X chromosome at XP21. This is one of the largest genes in the human body, which is why it's prone to mutations. Dystrophin anchors muscle fibers to the extracellular matrix and prevents muscle damage during normal use. Dystrophin also anchors neuronal nitric oxide synthase, or NNOS. This is crucial for blood flow during exercise. So when dystrophin is lost, muscles don't just weaken, they also suffer from poor perfusion. When dystrophin is absent, the muscle cell membrane, the sarcolemma, becomes fragile. Tiny tears form during contraction. Calcium rushes into the muscle fiber. Creatine kinase leaks out into the blood, and this calcium overload triggers muscle fiber necrosis. This explains why patients have very high creatine kinase levels. Muscle cells are constantly breaking down. Over time, the body can't regenerate muscle fast enough. With repeated injury, normal muscle tissue is gradually replaced by fat and fibrous tissue. This leads to muscle wasting, loss of strength, and visible deformities. There are two common types of muscle dystrophies. Duchenne muscular dystrophy is the most common muscular dystrophy in children. It affects around 1 in 3.5 to 5,000 male births. Becker muscular dystrophy is less common. Its incidence is approximately 1 in 18,000 to 30,000 male births. Becker is milder and often diagnosed later in life. Now let's compare Duchenne and Becker muscular dystrophy. Both are X-linked recessive conditions. A carrier mother has 50% affected sons and 50% carrier daughters. Why is Duchenne more severe? The key difference is mutation type, not inheritance. In Duchenne muscular dystrophy, there are frame shift or nonsense mutations. This leads to complete absence of dystrophin. In Becker muscular dystrophy, mutations are non-frame shift, so dystrophin is partially functional. Let's focus specifically on Duchenne muscular dystrophy. Duchenne is an X-linked recessive condition. There is a complete absence of dystrophin, which makes it the most severe form of dystrophinopathy. Symptoms begin early, usually between 2 and 5 years of age. The disease progresses rapidly. It mainly affects boys, while girls are usually carriers. Unfortunately, because of cardiac and respiratory involvement, Duchenne muscular dystrophy is associated with a reduced lifespan. One important exam point to remember is this. Although Duchenne mainly affects boys, some female carriers can be symptomatic. They may develop mild muscle weakness or even cardiomyopathy. This happens due to skewed X chromosome inactivation. Becker muscular dystrophy is milder. Onset is later, usually in adolescence. Patients often have a normal or near normal lifespan. This is because some dystrophin function is preserved. In Duchenne muscular dystrophy, children present early. They have delayed motor milestones, difficulty running, climbing stairs, and frequent falls. One classic sign is Gowers' sign. The child uses their hands to push on their thighs to stand up from the floor. This happens due to proximal muscle weakness. The calves may appear enlarged. This is called pseudohypertrophy. It's not true muscle growth, but fat and fibrous tissue replacing weak muscle. Dystrophin is also present in cardiac muscle, so the heart is affected too. The most common cause of death in Duchenne muscular dystrophy is dilated cardiomyopathy. Progressive respiratory failure also contributes. Initial investigations show very high creatine kinase. Aldolase is also elevated. The confirmatory test is genetic testing. Muscle biopsy is now rarely needed. There is currently no cure. Management is supportive. Corticosteroids can slow disease progression. Regular cardiac monitoring is essential. Respiratory support and physiotherapy improve quality of life. Remember these exam points: X-linked recessive mostly affects boys. Calf pseudohypertrophy is due to fat infiltration. And Becker muscular dystrophy is milder with later onset. Understanding dystrophin explains everything about these conditions, from muscle breakdown to cardiac failure to raised creatine kinase. If you found this helpful, like, share, and subscribe, and I'll see you in the next video.